Okay. Wow. That's a good way to start, I guess.
We got the nerves out, and the food thought what or whatever. We got it.
Yeah.
We got it out of the way, and
All right. You ready, Beth?
sure.
Okay. Welcome back to the podcast. Today we are talking about something that affects all of us every year: flu season. This year, our community is experiencing higher flu volumes or flu rates than other areas around us. So it's especially important to bring in someone who works behind the scenes every day to keep patients, staff, and visitors safe. I'm joined today by the infection prevention nurse at Kit Carson County Memorial Hospital, Beth. Thanks for being here,
Oh,
Beth.
thanks for inviting me and allowing me the opportunity.
Yes. So for our listeners that don't know you, can you tell us who you are, how you came to KCCMH, and what you do here?
Yes, I'm Beth Saxton. I'm an RN. I've been nursing since 1983, so quite a long time. And I came to Kit Carson in October of 2023. I had previously worked at a position for 40 years, and my husband retired, so I decided I would slow down and find a job that I could really be of value and hopefully bring something good to the organization and make it better, while also being able to go home at the end of the day and go home. So I was looking for a new job, and this came up, and I had done infection prevention since 1983. It was like a 2-page binder was all that was part of infection prevention, and I was hired, and I'm loving my role here.
Awesome. So as long as you've been a nurse, you've had some part in infection prevention?
Yes.
Oh, wow.
Yeah, but I passed my boards, which back in the old days, you got to take it twice a year, and then you waited for 3 months to hear your results.
Oh, wow.
And as soon as I passed boards, they passed off the binder and said, "This is now yours."
Congratulations.
Yes, you have
awesome.
inherited.
Very cool. So your job is one of the roles that people don't always see, but it touches nearly everything in the hospital. So why is having an infection prevention nurse so important to the hospital overall?
I think having a specific nurse that does this and only this is important. Everybody understands what infection control and prevention is. And initially, it started off as just infection control. But as the years went by, we learned how important it was to prevent and control. So you kind of hear the words used interchangeably, but it really is a two-part. We want to prevent anything, and if something does occur, we want to be sure and control it. And I think it's important to have somebody that can kind of bring all the masses together, because each of us, I may be in charge and kind of lead the charge for it, but it really takes each and every one of us, regardless of what our position is in the facility, to bring it to fruition and really provide safe and healthy care for our patients, keep from spreading infections, teach people about how to keep our communities safe, as well as in the hospital. It takes all of us, but you have to have someone run it to kind of bring the masses together and enhance collaboration.
So a position like yours is especially important during like a high rate flu season?
Correct. We really relied, and I think that became even more evident during the COVID pandemic, how important infection prevention, physicians, nurses, and those people were, because they could kind of gather that data and get it out to everybody. And as we know, that was changing by the minute. And so you had to have somebody there that could kind of grab that and then get it out to everybody to keep not only our patients safe and providing the highest quality of care, but to keep our health workers safe and healthy so that they could continue to provide that care.
So you're saying infection prevention is a team sport. You're the coach?
Yes,
Okay.
absolutely. Yeah.
I love that. So how does everyone from nurses to environmental services to visitors play a role in infection prevention?
Again, it's that collaboration. When you look at environmental services, if you don't have a team that is spot on with not only cleaning but disinfecting and keeping the hospital clean and disinfected, that's kind of where we start. And we're lucky, as are most small hospitals, we have very, very dedicated staff who know their job and know how to take care of that for us. And then for our workers and stuff, it all starts with hand hygiene. And I'm kind of starting to tease that I'm the broken record, because that's all I keep saying is hand hygiene, hand hygiene, hand hygiene. But we've got to do what we need to do to take care of ourselves. And if we take care of ourselves, we then pass that along, and that allows us to take good care of our patients.
Agree. And I know that we always get so many compliments on how clean our facility
Yes.
is. So it's kind of a double win, right? It
Yeah,
looks great and it's also keeping our patients and staff safe.
absolutely. Absolutely.
So, what are some infection prevention wins or improvements that we've seen recently that the community should know about?
I think just everybody being more open to it being a collaborative effort. Like you said, it is a team sport. It takes all of us, regardless of what our position, whether you're in the office, in the ED, EVS, dietary, wherever you are in this facility, it is a team sport. And it really takes all of us working together. And so I think everybody's continuing to enhance education, their knowledge, and then through that knowledge, enhance their skill set so that we can, again, provide that high quality care, prevent infections from occurring within the facility, and then hopefully keep our community well.
Yeah. So, how do you measure success in infection prevention?
Several ways. We use work with Sarah Chacon on some quality improvement programs. So we look at our hand hygiene. We share our rates with our staff. You know, again, that broken record, keep reminding them about hand hygiene and the importance of it, not only for our patients, but for themselves. And if we keep ourselves well, again, we take good care of our patients, but we also keep our families well. And it's important to keep our families well. The other ways are just through quality measures, looking at where our infection rates are at. If we find that something's changed or has jumped on us, trying to figure out what that root cause of it is and what we're going to implement to get that back down to that zero or near zero rate as best we can.
Okay. What are some things our staff should feel really proud of when it comes to preventing infections?
Again, I think it just goes back to their general knowledge that, they know what to do, they know how to do it. They know where their resources are, so if they're uncertain about something, they'll come and ask me or they'll ask Lana, but they know their resources as well as the information, and so I think they're able to then, like, just embed that into the care they provide every day.
So, what has been obviously it's flu season. Is that kind of our number one target right now?
I believe so. That's what I'm kind of focusing on right now is kind of especially influenza A because we're seeing a lot of it, but also kind of seeing where our COVID and RSV numbers. This is that time of year. RSV usually is a little bit later in the season. Influenza season's October 1st, and I think this year it goes through May 23rd.
Through May.
May, yes,
Oh
and
my
it used
goodness.
to end a lot earlier, but a lot what we're finding about out about the respiratory illnesses is we used to think they just had a season, and they have kind of their season and a peak season, but they kind of can. I mean, you can have influenza during the summer. You won't see a lot of it, but you'll see it. So we're right at kind of that main season, and so focusing heavy on those respiratory illnesses, and because we're seeing a lot of influenza A, as is the whole nation, really focusing on where our numbers are there, and then trying to see what we can do to kind of help reduce the spreading.
So, can you tell us a little bit more about influenza? Like, how is it spread? What maybe are some of the signs and symptoms? Or if you think you have the flu, what might bring you into the hospital?
So for influenza A this year, what we're seeing is influenza A. I believe it's the H3N2, and it's the clad K variant, and that's what's getting everybody is this variant. The vaccine is probably one of the key things that we can do to help prevent ourselves from getting the flu. And if it doesn't, it's not 100%. But if we end up getting the flu, what it will do is it'll help prevent severe illness, hospitalization, and poor outcomes from influenza, especially for our populations that are at risk, our pediatrics, our immunocompromised patients, and our elders, and those that have like other high risk illnesses such as respiratory, cardiac, those sorts of things. So getting the vaccine is helpful. Signs and symptoms, it starts abruptly with this, especially with this variant. You can feel good one minute, and that next minute you feel like you got run over by a truck. They say the body aches are terrible, high fevers, 103 and higher, cough, runny nose, chest congestion. Again, those overall body aches, headaches. Those that have had it said it is pretty miserable, and they felt pretty miserable. For staying at home, it's just a matter of hydrating yourself, monitoring yourself for pain and fever, and taking something to kind of help with those body aches, the fever, getting rest, and again, staying hydrated. When you need to come to the ER is if people start having trouble with shortness of breath, they're not able to break the fever, especially when you're looking at the pediatric population, our elders, because they're more at risk. They might act like they're doing well, and then all of a sudden they're not doing well. Parents and caretakers just want to stay on top of those populations. Giving a call to the ED or to the clinic is always a good idea as well. If you're not sure, you can get advisement then on whether you're doing great, keep doing what you're doing. If these things happen, just come in or give us a call, or you know what, let's take a look. Make sure that we're not getting into like a secondary illness such as pneumonia, ear infections that really do need antibiotic, because as we all know, the flu is viral. So an antibiotic is not going to help us. There are antivirals such as Tamiflu that needs to be looked at with a physician to decide if 1 year in the window for taking it from onset of symptoms, as well as what other medications you're taking and whether that might change that up. But antibiotics are not going to help you get over the flu unless there is that secondary infection, and that's what we hope to prevent.
So can we assume that because of our flu rate being so high, especially here in Kit Carson County, even among our hospital staff at one time, that it's very contagious?
Yes. Usually they're saying we shed the virus probably 1 day before we actually have symptoms. So we're actually sharing it with each other. From the time we're exposed to the time we might get it is like 1 to 4 days, with around day 2 being about the time that we'll pass it off to each other. Symptoms last for 4 to 5 days. Some people, what they're seeing with this flu variant is they start to feel better about day 3 or 4. And then like day 6, it comes back with a vengeance, and which seems totally unfair. You've already weathered part of the storm, and now you get to go through another. Yeah. But that does seem to kind of be the pattern that it's following. While you're well and we've got such great weather, again, exercise, eating well, getting plenty of rest, staying hydrated, opening up windows and getting good ventilation in your house. Being aware that if you are a population that's immunocompromised, again, our elders, pediatrics, those with ongoing illnesses, kind of staying away from crowds or maybe wearing a mask. And I know, masks can be a really touchy subject for people, especially after COVID, but doing that source control and protection for ourselves, especially if we know we're at risk or the person that we're with is at risk, can really be beneficial, because I think we're going to see, we started seeing numbers peak like after Thanksgiving when everybody got together. And then we've had, winter break and Christmas. So again, everybody's getting together, and you don't know that you're feeling bad until you feel bad. But like I said, we're actually shedding that virus a day before we start having symptoms.
So are you saying that a mask could be beneficial to people that are immunocompromised
Yes.
or more at risk of getting the flu?
Yes, act as kind of a prevention. With influenza and like pneumonias, they're bigger droplets. Kind of getting into a little bit of the science, but they're bigger droplets, and they only go in the air about 3 feet and kind of falter. And so a mask kind of then helps act as a barrier to prevent that from kind of them breathing that in and then becoming ill.
So I feel this time of year with like wrestling season and basketball, everybody's in the gym for hours at a time, close quarters.
Right.
I feel like it's just a breeding ground for the flu.
It sure can be. And that's, again, where you just want to kind of weigh your risk and your benefits and then do what you can. And again, everybody masking is not kind of where people want to go. Do what you feel is best. It takes good care of you and those that you may be caring for. And I think otherwise it just comes back down to taking care of you. And then again, good hand hygiene.
So are we seeing our flu numbers go down?
We're, right now, I checked my numbers this morning, and of the number of people that we've tested in the ED, we've had 115 emergency room visits since January 1st. And of those, I've had 34 people be tested. 17 of the 34 are positive. So about a 50% positivity rate, with 14 of those being influenza A, 2 being RSV. We just had our first 2 RSV cases this weekend. and only one COVID. But we did have increased hospitalizations for influenza through December, which was a little unusual for us. Usually we're kind of sporadic. We have one here, one there, but throughout the month of December, we had 5.
Because it's just really knocking people down hard.
It is. It is. And again, kind of impacting those we've hospitalized have been those that have had other illnesses. And so it just kind of, their immune system isn't quite where it needs to be. And this is hitting people particularly hard, even our well population. We're seeing pediatric cases to 20s to 40s and on up. So it's not just hitting one population.
So can you tell me a little bit about RSV? Because usually that's affects infants, right? But also our older population?
Yes, it can. And usually in adults, kind of what we see, and unless the symptoms get really bad for them and they start having more trouble, it may just seem like a cold, kind of runny nose, a little bit of cough, just not feeling well. And so you feel like you just have a cold when in fact it's RSV. And as for somebody that's compromised and their immune system isn't where it should be, the symptoms just become exaggerated to where they start feeling short of breath and those sorts of things. Incubation period again is, I think they say, is like 2 to 4 days. Again, shedding the virus one day before we actually exhibit symptoms, but usually start off a little bit milder unless they have ongoing medical issues. And again, it's just kind of waiting it out and doing what you can do to appease the symptoms and kind of make the, like Tylenol, something for decongestant if they need it to kind of help the symptoms be a little bit more tolerable.
Gotcha. And again, it's a virus, so
Again,
there's no medication for it?
No, not unless you get like a secondary bacterial infection and, so just if they get pneumonia, ear infections and those sorts of things. And then the provider would put them on an antibiotic.
Okay. So stay healthy, everyone.
Yes. It's unfortunately, it's that time of year, and we all know that it's that time of year, but it does seem to be hitting all of the U.S. pretty hard. Colorado was one of 3 states, along with New York and Louisiana, at the first part of December that were already in the high range for influenza A. And currently we sit in the dark purple, which has us at the very high of the CDC tracking for influenza-like illness. And they're about a week behind, but it's still, we really aren't at the peak of influenza. So to be seeing these types of numbers and the illness spreading as it has, I think that's where the concern is for when we peak. Where is that going to be? So again, it's not too late to get a flu vaccine. There's plenty of it. You can get it at the clinics. You can get it with public health. It's not too late. It does take about 2 weeks. I know there's always that every time I get the vaccine, I get the flu. It's an inactive vaccine, so it does not give us the influenza. It's probably just coincidental that it happened, but I can understand where people are concerned about that. But again, it's not too late to get the vaccine. And just have that bit of protection so that if you do happen to get it, symptoms are milder, you hopefully can stay out of the ED, definitely stay out of the hospital.
Yeah. Okay, so it's not too late. And
No.
like you said before, you might get the flu, but it will hopefully be just a milder version that you can care for at home.
Yes.
Okay, so can you give us your top 3 tips to stay well now that you've just sadly informed us that we are not even halfway through flu season?
Yeah. I think the one, get your flu vaccine if you haven't already. Make sure you and your family, if you feel like, I'm a well person, I'm good, that's an individual decision, but make sure that those that are kind of in those high-risk groups, the pediatric population, our elders, again, those that are immunocompromised either because of ongoing illnesses, chemotherapy, immunotherapy reasons, make sure that they're getting vaccinated. And then just do all the healthy things, eat well, stay hydrated, get plenty of rest, get exercise. And again, with this time of year, they talk about increasing the ventilation. So it's hard usually this time of year because we're usually cold and freezing, but we've had such nice weather. I think open up the windows when you can, and then just kind of weigh your risk and benefits. Like you said, with basketball, wrestling, and all the kids' sports that are going on, as well as church activities and other stuff. I think just kind of weigh your risk and benefits. Mask if you think that's appropriate, and definitely wash those hands.
What about hand sanitizer?
Hand sanitizer is great. They feel actually that hand sanitizer does a better job of cleaning our hands than actually washing. But definitely, if your hands are dirty, wash them. And then after about every 4 to 5 uses of hand sanitizer, they say it's a good idea to wash. But hand sanitizers are wonderful.
Okay, that's probably why we see it everywhere.
Yes, yes.
Okay. So before we go, can you tell me maybe one of your best moments or highlights as a nurse? Not necessarily here at the wonderful Kit Carson County Memorial Hospital, but
Yes.
you told us you've been a nurse for a long time, and can you maybe share a highlight in your career?
I think if you look at it from infection prevention point would be what the small hospitals did during COVID. We have far few resources than the hospitals that are all up west. And we still, all of us collectively, did a marvelous job of taking good care of our patients, getting the information out, not only to our community and patients, but also to our staff so that we could keep everybody well. And I think any infection prevention nurse, physician, and that whole committee, as well as all of the hospital staff, should feel really proud of how they stepped up and responded and just bit the bullet and dug in and took good care of our patients while also taking good care of the community as a whole. And so to me, that's a great highlight. It was a tough deal to go through, but I think everybody did a great job.
Oh, that's awesome to hear. So, if you had one more thing to tell our listeners about infection prevention, not necessarily the flu, but anything, like what would you want our listeners to take from today's message?
I think just that overall infection prevention is a needed resource, if you will, for the facility. And again, it is a collaborative effort, and it's just everybody working together to make sure that we do all that we can to prevent infections from occurring while people are in the hospital, whether it's a hospital stay or just visiting for lab imaging, the ED, specialty clinic, and then taking good care of them when they're here. And it's kind of looking at the big picture and then getting down to the nitty gritty in order to meet those needs.
Fun. So you're like a viral detective.
Some days, some days.
Well, thank you,
Excuse
Beth,
me.
so much for joining us
Well,
today.
thank you.
And thank you guys for listening to another episode of the KCCMH Connection. Again, wash your hands. When you come into our facility, at every door, there is a hand sanitizer station and a masking station. So definitely use the hand sanitizer. And if you feel appropriate, then there's a mask there for you to use or to take. But thank you for what
Yeah,
you do, and not only keeping our patients healthy and safe, but also our staff and their families. That's really important.
I think so. And just to kind of close out with that, we are, kind of right now because of the number of cases that we've seen in the hospitalizations, we are kind of, really monitoring our visitors and asking them to stop at the nurse's station to check in, make sure they don't have any symptoms. Excuse me. So that, again, the patients that they're visiting, we can keep them well as our visitors. So it's not there to impede anybody's visits. It's there to make the visits safe.
Yeah, I've seen those signs, and I know that we host or we take care of swing bed patients, which are generally older people that might be rehabbing from something. So it's really important that our visitors help keep them safe too,
Yes.
right?
Yep. They can play a very vital role in our infection prevention program. Absolutely.
Awesome. Okay. Well, thank you again
Thank
so
you.
much.
Thank you.
And we appreciate you guys tuning in again. If you want to hear more information about what's happening behind the scenes at Kit Carson County Memorial Hospital, then log in to the KCCMH Connection. Thank you. Bye.
See you.